Good evening, everybody, and welcome to the New Teeth Now webinar. I'm Bianca, and I'm here with Dr. Richards.
Hello.
Hello. And tonight we are going to be talking all things full mouth dental implants. We're so excited you're joining us, and we can't wait to answer all of your great questions. And so the way to ask questions that we can answer is literally just to type it out in the chat box on YouTube. So it's as simple as that. We can even pull up the question on the video, which is really cool. But we're going to just go ahead and get things started. We also have a new pen tool. You might see that Dr. Richards might like doodle and show you guys around the implants and things like that. So that's a fun addition as well. All right.
I can draw pictures and that could be dangerous.
Yeah. So let's get to Dr. Richards. He is a board certified oral and maxillofacial surgeon since 1982. So he has over 40 years of dental implant experience and has been here since like the beginning of placing implants.
Beginning of time.
So he has a lot of experience and knowledge just about how it's evolved over the years. You want to just kind of tell people maybe what's happened in the last 5 years that's made it so different and so much better?
I think in the last 5 years it's going into the digital world, and there's no doubt that that's made things better. More efficient, more accurate, with the printing of the initial teeth that a person would get on the day of the procedure. They are now printed from digital impressions, and so it's quicker. We can get folks out in the afternoon quicker with a more accurate, stronger set of teeth that also look better. So I would say, if I could just pick one thing in the last 5 years that has made things easier and better, it's moving into the digital world.
Yes, I agree. That is a big difference. And just to show you guys what the teeth actually look like and what you'd be getting with a full mouth hybrid, this would be the upper. So what are they looking at here?
Well, you have x-ray eyes when you look at this slide so that you can see through the bone. You can see where the implants are in the bone. You know, a lot of people seem to come in with misconceptions about how this works. And so the implants are those threaded things that look like screws, because that's what they are. And they're in the jawbone. And so you have to have jawbone. One thing I don't like about this slide is it shows implants that are well into the rear of the slide. And in the upper jaw there is something called a sinus, and we have to manipulate our way around the sinus in most all situations. But in any event, you're seeing through the bone, you're seeing that there are implants. Those implants are in the bone. And then as you come down towards the teeth, you're seeing pink material, which may be the person's own gum tissue, or in the event where the person has lost a lot of bone, then there would be more of that pink porcelain to fill in the gap between the teeth and where the person's natural tissue is. And then of course you see the teeth. And so in these types of hybrid teeth, the teeth can be set independent of where the bone is. When you're dealing with crown and bridge work, actually what most of you guys would know as caps, when you're dealing with that, the implant has to go exactly where the cap is going to be. But when you're dealing with a hybrid, then the implant does not have to go exactly where the tooth is going to be, because in a majority of these situations there's significant bone loss, and so the implants cannot go exactly where the teeth are going to be. The teeth have to go where the teeth need to be in order to look good and chew, and so the implants have to go where the bone is, so there's frequently a mismatch, but it works, and it works very well.
And then for the lower, it's pretty similar.
It's a very similar thing in the lower. There's no sinus, although there is a nerve in the lower jaw that we have to be mindful of. And this nerve, for those of you who are maybe nurses or medical people out there, the nerve that we deal with is called the trigeminal nerve. It's the fifth cranial nerve, and it controls all the feeling in the face. There's 3 divisions, and we deal with division 2 and 3, which controls the feeling throughout the cheeks, the upper cheeks, upper lip, and the lower lip and the chin region. That's called the trigeminal nerve. But this is basically the same. And there's maybe a little bit thicker zone of artificial gum tissue, and that zone of artificial gum tissue will vary depending on the amount of bone loss that a person has.
Which that brings up a good point about bone loss. And just to give a question to start, a lot of people do ask, like, we have a solution for bone loss in the upper jaw, but what happens if someone has bone loss in the lower jaw? What can we do with that?
Well, a lot of people, most all people have bone loss, and it just depends on to what degree. If a person has 10 millimeters of bone left, then we can use these types of implants that you're seeing in these 2 slides. Now, if a person has significant bone loss to where they have these so-called pencil-thin mandible, to where they maybe have 6 or 7 millimeters, then we go the route of using a subperiosteal implant. And the subperiosteal implant would be used, it would be preferable to getting into complicated bone grafting procedures.
Gotcha.
So.
And we'll be able to talk about zygomatic implants for the upper in just a few slides here, but I'm going to go into how surgery day would work. So if you were to book surgery, come in the morning around 7:30, you'd be put to sleep under general anesthesia for a completely painless procedure. You're sleeping the entire time. If you have any teeth left, they are first removed, and then Dr. Richards would place all of the implants you needed. And while you are still asleep, we will take impressions for the lab to customize the teeth, which is now all digital and scanning with our Micron mapper. And then the patient will wake up in a private recovery room while our lab is creating those same day teeth. Those teeth are placed in the mouth and adjusted, and you'd go home in the late afternoon. So that's a simple, process of how the day would go.
Sounds simple.
Yes, this is the simplified version.
However, this is a culmination of many years of doing this to get it right, so to speak, get it right. I mean, this is all I do now, and my partner, Dr. Kirkpatrick, this is all he does. And so we have had the opportunity to do enough of this to where we can get it right.
Yes.
And that slide simplifies something that is a culmination of years to be able to get it right. Some of you may be thinking about this general anesthesia, and I can't remember if we have some slides a little bit later that have the nurse anesthetist, but we use certified nurse anesthetist to administer the general anesthesia. We, as the surgeon, do not administer the general anesthesia and do the procedure. So we have excellent anesthetists who work in our office with us. And so this general anesthesia, it's just like in an outpatient surgery center, or it's like being in the operating room in the hospital. I mean, it's full-blown general, it's lights out and lights on, and you're done 3.5 hours later. So we have determined that that's the way to go for everybody. And of course, some of you also may have questions about, am I healthy enough to undergo general anesthesia? And so before we would place a person under general anesthesia, then we would get a medical clearance from their doctor or doctors, particularly if they have heart disease or lung problems, that sort of thing. So we cover those bases before we put a person under general anesthesia.
That's a great thing to bring up when you are like looking at different facilities, to ask what their anesthesia is, because they'll usually say, oh yes, we use anesthesia, but it's like, what type of anesthesia?
Right, and who's administering it?
Yes, definitely. All right, awesome. And this is our innovative technology. Will show you kind of what we mean by the digital impressions. If you'd like to show people or tell people what they're seeing.
This is what's called a micron mapper, and it is a digital impression taker. And it will take a full impression of all of the implants in about 6 seconds. Depending on the skill of the operator, it could take 10 seconds, it could take 5 seconds. But it takes an impression and is very accurate. This is a scanner, an intraoral scanner, so that after the implants are placed and the abutments are selected, and after the micron mapper has been used to take the impression, we do have a denture guide that we relate to the implants to be able to take a bite, so-called bite relationship, so that at the end of the day, when the teeth are put into the person's mouth and they bite down, they have a proper bite. So this is all of the digital scanners that we're using, and this is a bench scanner that's used in the lab. Once these scans are taken of the person and the teeth in the operating room, they're emailed to Roxy, who is our tooth designer, and who's in a different building, and she takes that and inserts it into a software and designs the teeth. Once the teeth are designed, she emails it back to our main office, and what you're seeing here is a printer, and the teeth then are printed. And Terry and his crew, after the teeth are printed, they take all of the sprues off, they clean everything up, they wash it, and then colorize it. So in this video that has lasted maybe 40 seconds or so, you have basically seen everything from the micron mapper all the way through to the printing of the same-day teeth.
Yes.
Yeah.
It's great.
Doesn't happen that fast now in the real world.
This is a lot of steps combined.
But it's pretty quick.
It's
Yeah,
awesome. It really
compared to the old way of doing things.
And that's another great benefit of having everything not only all in one day, but all in one office, because we have our dental lab, our restorative doctors, and our surgeons in-house, which really just helps for better processes, better communication,
Yep.
all of that.
And we've got world-class surgeons.
Yes.
We have a world-class dental lab, and we really have world-class restorative doctors. And we just added one that's like, he's almost beyond world-class. So
Yes, Dr. Perez just
yeah,
joined
Dr.
us.
Perez.
Yes.
So, we've got these rings covered, and, that is the sweet spot. That black area right there in the middle, that's where we are, and that's the sweet spot. And that is what enables us to provide our clients with the best possible care that anyone can give anywhere.
Definitely. And we did have a good question come in about anesthesia. Kevin
Good.
says, can you use IV sedation instead of general anesthesia? I am missing the upper lobe of my left lung, and I have 3 coronary stents.
It's possible to do IV sedation, yes. Yep.
So that is an option. Awesome.
I mean, I could elaborate on that, but yes, it is possible.
Um,
And depending on the complexity of what we're doing, let me just add that if a person would need zygomatic implants, then that's very difficult with IV sedation. Most regular procedures that we do could be done with IV sedation. When you're doing a double jaw procedure that could last 3.5, sometimes maybe even 4 hours, IV sedation gets a little cumbersome. Whereas general anesthesia, the person's totally out. So, but the answer to your question is yes.
Awesome. And please send us more questions. We would love to be able to answer those. And then we're going to hear from Jennifer. So we love just sharing stories from the actual patients themselves. So she had a lot of bone loss and periodontal disease, and she just kept putting off, taking care of her teeth, and it kind of caught up to her. And she's going to explain how New Teeth Now made such a difference.
What's going through my mind is that's the old Jennifer right there, and the old smile. Thank God I did something new. My name is Jennifer, and I'm a real patient at New Teeth Now. I came to New Teeth Now because my teeth were just messed up, and I had 90% bone loss. I had periodontal disease. It did accumulate over the years, but I also kept sweeping under the rug. I'll deal with it later. I'll deal with it later. And so it just caught up on me, and I couldn't deal with it later. My jaw would hurt, my ears would tingle. It just hurt to eat. It is painful. A hot or cold stuff was very sensitive, and my teeth would not stop bleeding. To the point I'm driving down the road to the dentist, spitting in a cup because I did not want to swallow it. And he was like, I can't help you here. You have to go see a specialist. So that's when I ended up at New Teeth Now. So I went in to see Harley Richards, board certified oral surgeon. He went to school for it. He knows. And I like how he gets excited about like new equipment he gets and stuff, and kept me at ease, talked me through all my steps. I got up early that morning, and I was nervous. I could tell you I was nervous, but once I got in there and they put the little happy gas, let me go to bed, I woke up and I was fine. Holy cow. Oh my God. Oh.
They do look pretty nice.
Ew.
Yeah, they look really.
I love them. Oh my God. That's $1 million smile right there. They did amazing. Amazing. They just feel good. Thanks to New Teeth Now, I can eat what I want. I feel good about myself. I can be comfortable in my own skin. I can smile. I can be healthy. I can do the things I want to do. It's a total booster. I smile more now. As before, I would just hide them. And now I'm just all smiles. Every time somebody looks at me, they're like, you just keep smiling. I'm like, I have so much to smile for. If you're on the fence on it, do it. You won't regret it. You only live once, and if it's an issue and it's concurring and it's been like this for years, you wasted all this money in this past couple of years. What is a little bit more to get it right? Just do it. You won't regret it. It's the best decision I've ever made. Because that's $1 million smile right there. Nobody can take that away from me.
So as you can tell, she has so much to smile for, and it's the best decision that she's ever made. So it made an incredible difference for Jennifer. And here is the actual scan of what it would look like in your jaw to have implants. So what are we looking at with these traditional implants?
Well, this is similar to the hybrid slides that we were looking at before. And on the top portion, that's the upper jaw, and the medical terminology for that is the maxilla. And if I can get my little pad here, I was going to see about drawing where the sinus is. You can see those 4 implants in the middle, they're sort of straight up and down, but the 2 on each end are tilted over. And I had mentioned something about doing little maneuvers to avoid the sinus. And this is just a tilted implant technique to avoid the sinus. Very common. I would say that pretty much every person, unless we're doing zygomatic implants that we'll talk about in a few slides, almost every person gets tilted implants in both jaws. And then if you look in the lower, you'll also see tilted implants. And whereas in the upper, we're tilting to get out in front of the sinus, in the lower, we're tilting to get around that nerve that I talked about earlier, that division 3 of the trigeminal nerve that controls the feeling to your lower lip and chin. And so the tilting throws the working head of that implant more to the posterior, and the body of the implant more to the anterior. So it increases the spread. It spreads the implants out more for a more stable platform. So this type of x-ray here is very common for what we would do.
And then if a patient has a lot of bone loss, we would add zygomatic implants.
Right. Now this is not extreme bone loss. This is where the sinuses come too far to the anterior to even fit in tilted implants. In other words, those 4 that are straight up and down, the far left and the far right straight up and down implants are so close to the sinus that there's no room to fit in a tilted forward implant. So we do zygomatic implants. And the zygomatic implants connect into the zygoma bone, which is your cheekbone. These are very stable. They're the most stable implant that we place, and they work well. They allow us to help someone with more bone loss than usual in the upper jaw. Zygoma implants are only for the upper jaw because the zygoma is the cheekbone. It has nothing to do with the lower. Now, there are folks that have even more bone loss in the front and bone loss in the back, and we're going to address that in a few slides. And then you see in the lower, and this slide is very good because it shows that little dark canal leading to that dark round hole, and so the implants are tilted to avoid that nerve, and there are additional short implants in the rear to supplement the 4 implants in the front to help break up any cantilever. And a cantilever is a term that's used to describe a segment. It doesn't have to be teeth, it could be anything, that sticks out unsupported. It's a cantilever. And so those little short implants break up the cantilever. Most people don't have enough bone in the posterior to have those shorter little implants.
And just to...
We have a little video here,
Yeah.
I think.
Just to show an animation of it and how the teeth are placed is just, it's good to visually see.
So that's an interesting little video that sometimes a picture is worth 1,000 words, and that shows you a visual to help you understand a little bit better.
Yes. All right. And then this is for cases of even
Right.
more extreme bone loss.
Where there's bone loss in the anterior of the upper jaw and in the posterior of the upper jaw. And these are what's called a quadzygomatic technique. And once again, this allows us to take a person that has no bone or very little bone, even not enough bone to wear a denture, and no bone grafting is necessary to do this technique. No bone grafting, no waiting months and months for bone grafts to heal, to do the 4 zygoma technique and be able to place teeth onto these 4 implants the same day. These are very successful and they work very well.
Yes, so if you've ever been turned away because you don't have enough bone, this is the solution.
Yeah,
likely.
if you've been told you don't have bone, because not everybody does zygomas, and really fewer people do quadzygomas.
Yes, so please get in contact with us at the number below, and we even have Lisa on the phones tonight if you want to call her and just ask more questions. If you have bone loss, we are the place that you should be going to for sure. And Dr. Richards has an amazing team of ladies that help him from A to Z.
A to Z?
Yeah.
They do. They help me from A to Z. I couldn't do what I do without their help.
So you'll get to know the whole team really well if you become a patient of Dr. Richards. And then we have 2 out of 3 of our restorative team. We have Dr. Nafala, Dr. Dibbs, and we just took some photos of Dr. Perez because he just joined us, but we'll add him for next month. He'll be on. But they are also an amazing team that
They
will
are,
help you.
yep.
And what does the restorative team mean? Like, what do they actually do?
Well, the restorative team sees the person before the procedure. They take records like photographs and impressions or now digital scans and talk to the person about the teeth and about their role. And their role is going to be in assisting, making the surgical guides that we use during the procedure. Once the teeth are placed on the day of the procedure, they assist in adjusting the bite or the occlusion. They see the person post-operatively to check the bite. And then at the end of the healing, they make the final definitive teeth, which are made out of zirconia. So the restorative team plays a large part in the overall process, primarily related to the teeth and the teeth placement and the bite and making the final zirconia teeth.
Yes. And we will watch a video just explaining how the restorative team and the lab work closely together.
One of the things that really sets Florida Dental Implants apart from other offices that are doing full mouth implant reconstruction, I have my own laboratory here on site that myself and the other restorative doctors are able to use. This is invaluable. Having the ability to work so closely with my lab gives me the ability to better help my patients with the emotional side of it as well. A large number of the patients that come to us for treatment have had severe dental problems for many, many, many years, sometimes dating back to childhood. Because of the emotional concerns that they have, we really have to spend the time with the patient. That you can't rush anything. We need to have ample opportunity to have questions asked and answered. Having my own laboratory here on site, this is invaluable, not only in terms of having the control over the quality of the product that we're making, but the ability to, if I've got a question with the patient about, can we make this change? Is this going to be feasible? I can go across the hall, get one of my lab technicians, and all of my lab technicians have been doing this for many, many years. Bring them across the hall and they can talk to the patient themselves. So we eliminate the need for me to try to interpret the patient's concerns and questions and needs in a phone call or in a note. They can speak directly to the patient.
It was so important to me to have everything under one roof. There's no waiting. That is the advantage of having the lab on site. And they are so proud of their work that they come out to see the product. These are not regular people with regular jobs. These are master artisans that create. They truly are artists. And they're creating beautiful smiles.
It's like nothing I've ever experienced, and I don't know of any other office that's like this.
So as you can tell, that's another benefit of why we work really well under one roof.
Yes.
And this slide I like to show just because now we offer zirconia even for your temporary set as well, so you can really tell the difference. So on the top here, there is a set of zirconia teeth. That's what you get for your second set of temporaries and your finals. And the bottom set that you see here is a set of acrylic. And both of these teeth in this picture have been worn for 5 years. And you can clearly see the difference in how they look and why we've completely moved away from acrylic and finals, but also for the temporaries because the zirconias just don't break. They're just super
Right.
durable and they just look so natural and beautiful. So that's another good question to ask when you are doing research is what teeth are your final teeth? Do you have to like upgrade to get the zirconias?
Right.
What's involved with that? Because some places upgrade to get the zirconia teeth as well.
Well, as you know, but the viewers may not know, even though we started doing final zirconia teeth around '06, somewhere in there, we were still using acrylic same day temporary teeth, and those things are forever breaking. I mean, a tooth popping out or teeth breaking or the acrylic breaking. So we took a big leap of faith and we started putting all of our clients that came in from out of state, we started putting them in zirconia teeth. And as luck would have it, all the breakage stopped because zirconia teeth typically do not break. So that was so successful that we said, you know, we don't even want anybody from St. Petersburg having a broken tooth that has to come over here. So we started putting every person in a zirconia set of teeth that we call temporary. And the reason is that the mouth will continue to heal. It will remodel and heal after the procedure. And we don't want to make the final teeth too early. A lot of people ask us, they went such and such a place and they, well, heck, they make the final teeth in a week. Well, that's great. We could do that too. The problem is your mouth changes. Over 4 or 5 months, the gingiva, the soft tissue, the hard tissue is going to settle and heal. And then if you have those teeth, you may have gaps open up between the teeth and the gums. So our process gives you printed teeth on the day of the procedure. And then at about 1 month, we move you into temporary zirconia teeth. And we have you wear those so-called temporary zirconia teeth. We have you wear those for 4 or 5 months until we feel that the healing is complete. And then you get with our restorative dentist and have the final zirconia teeth made with digital scans of the tissue so the computer can match the teeth to the exact contour of the tissue. And we feel that this process gives our clients the best possible outcome.
Definitely. And we had someone on our New Teeth Now, like our community group page on Facebook. She asked, or she was wondering, like, I think she got a second set of temporaries, and she said it like closed the gap a little bit, but she still has more of a gap. So she was asking patients, like, will the gap fully close when she gets her finals? And everyone was like, yes, it's going to get even better. It's because of the shrinking is still occurring during healing. So yeah, something to look forward to for sure.
Yep. I hope that clears that up. If there are any questions about that, just shoot them to us, and we'll get into that deeper if we need to.
And these are our implant coordinators. We have Shauna, Chastity, and Allie at our Lakeland location. And if you come in for a consultation, you'll meet with one of them, and they will walk you through the entire process. And at a consultation, we will first take a CT scan. You'll go through that with Dr. Richards and with an implant coordinator, and we'll develop a treatment plan with exact fees. So you will leave knowing exactly what you would be getting if you came to New Teeth Now. And we finalize the treatment plan through the CT scan as well. So to give you kind of a overview of the entire process, so say you come in for a consultation, it goes well, you decide you want to go and have surgery, then we see you for a pre-op and impressions appointment before surgery. That's where you're gonna work with the restorative doctor to like design your teeth as well, your first set of teeth. And then surgery day is the single day. You'll have recovery and some post-op appointments following that. And then once everything has healed, we will create the final set of teeth and place the finals. And then you will have to just maintain them, which what does maintenance really include for somebody?
Well, we include 2 years of maintenance when we do the procedure. A maintenance visit would include you coming in, obviously, and having one of us, either one of the ladies that works with me or I do that sometimes, just unscrew the teeth. And everybody goes, oh my gosh, does that hurt? No, it doesn't. So we just unscrew the teeth. There's typically 5 or 6 screws. We unscrew them, the teeth come out, and then we can clean those teeth by putting them in an ultrasonic cleaner with tartar remover on it. Then we go to the person's mouth and check all the abutments to make sure that they're tight. That involves just a little driver that we use with our finger, and just check, make sure those screws are tight. Look at everything, make sure everything looks good, and then once the teeth are cleaned, put the teeth back in and check the bite or the occlusion. And that would be a routine checkup visit.
So it's definitely less troublesome, I guess, than just getting your teeth cleaned at the
Oh
dentist.
yeah, absolutely.
There's nothing
Yeah.
like poking in your mouth or anything
No,
like that.
No,
And
no
then
poking around.
daily maintenance is brushing and flossing with a water pick, just like normal teeth.
Yeah, it's just like what you do probably. Brush your teeth with a toothbrush and toothpaste and use a water pick. You cannot get in between the teeth because it's a solid bridge. So dental floss doesn't work in this setting. But the mainstay is toothbrush, toothpaste, and a water pick.
Yes. Okay, so this is a fun, important slide. We have our key differentiators that when you're doing research that make us kind of like stand out from others. And do you want to, we kind of touched on this.
Yeah,
but do you
yeah. I
wanna
mean,
touch on anything
all
else?
of us are board certified oral surgeons, and that's kind of a rigorous oral exam and written exam to become board certified. So it's kind of that's a big deal in our specialty. Zygomatic implants. Dr. K and I have been placing zygomatic implants since 2006, and we do them every day. I did zygomatic implants today. He did too. Sometimes we'll do 10 a week each. It's just it's something that we have to do. It's just another tool in our little tool bag that we have to pull out occasionally. Sometimes it's pre-planned, and other times we do it when it's not pre-planned to place zygomatic implants. And they're a workhorse in our business. We probably utilize zygomatic implants in 85% of the upper jaw cases that we do. And then general anesthesia and everything that goes along with that. Not to mention the fact that the person is monitored by a highly trained healthcare provider, certified registered nurse anesthetist. Most of the anesthesia in this country is delivered by CRNAs. They are sticklers for health and getting preoperative clearances. Every person who's going to go to sleep is cleared by one of our certified registered nurse anesthetists. So, that's been a big deal in our business, and it allows us to complete procedures for people, and they are totally comfortable throughout procedures. And most of you guys out there are probably of the age that you've had endoscopies and colonoscopies and all that kind of thing, and you know that you just turn the light off and the light comes back on and you're done. So it's been a big benefit in our business to be able to deliver some of the more complicated procedures that would be difficult with IV sedation. So yep,
Yeah, that's great.
that's kind of what sets us apart
Yeah,
for sure.
It does. And before I move into resources, I feel like we touched on a lot, but is there anything else you want to add?
Well, I think one of the other key differentiators is that you ask someone how many procedures that they do. If I'm going to have my total knee done, then I'm going to go to the big dog who does total knees all the time, or shoulders, or heart valves, or coronary artery bypasses, or anything that you're going to have done. Would you elect to go to the person that does one a month, or would you elect to go to the person that does one a day? And so literally we do one a day of these, each one of us, one a day. And that's why it was so important for us to have the lab support and the support of the restorative dentist and the support of the certified registered nurse anesthetist. Because to do the kind of volume that we do, you have to have a full team to make it happen, to pull it off. And so I think that we do a better job than anybody because we have more volume, we do more of this kind of work than anybody else around, and we do more zygomatic implants than anybody in the country. So, you know, if you really are in a bind with bone and that sort of thing, you know, we're the people to come to for sure.
Definitely.
So I can't think of really anything else.
No, that's great. That makes, I mean, yeah, I wouldn't want to go to a place that only does it once a month. Definitely not. And we have a lot of resources that you can check out after this webinar. We have our Facebook, our Instagram, our YouTube channel, which you are on, and our TikTok at New Teeth Now. You can watch more patient videos, see before and afters. You can always message us on there, and we're happy to answer your questions. And then if you give us a call tonight at 1-800-615-5838, Lisa is on the phone for at least the next like half hour to an hour. So you could go ahead and set up that free consultation. I totally recommend doing that, at least getting your options and being aware of what procedure you could have. And I also recommend jumping onto the New Teeth Now community if you want to talk to real patients that are going through this process. That is a great community on on Facebook. So you can search that in like the search bar on Facebook. Thanks for being here, and we're just excited to talk with you more about your individual case. So I highly encourage you to message us or call us, and we will be happy to speak with you.
And you said phone consults. We're really doing Zoom consults.
Yes, yeah, video.
Yeah,
So you can actually
Zoom
see
video
the doctor
consults.
and see the coordinator. So it's good. It's really good.
Yep.
All right, everyone, have a wonderful evening.
Good night.